Let's talk about how you would know that you are a patterned individual and that your patterns are the cause of your chronic pain without necessarily being tested by a professional. So, in my opinion, there are a few common indicators. This is not applicable to absolutely everyone because people and their circumstances are going to be unique sometimes, and not everything is a one size fits all. This video is going to be more about common findings. So if this stuff applies to you, great. And if it doesn't, I'm sorry, but hopefully more future content will be able to address your needs. So I would say the biggest thing is postural analysis and not misinterpreting what we see. So the first thing, starting with Left AIC and how we might start to figure out that someone is stuck in Left AIC, is pay attention to their feet. If their feet look something like this, then that, in my opinion, can be a very good indicator they are stuck in Left AIC. And here is why. When our feet are shifted to the right, in other words, our center of mass is shifted over to the right, and we're stabilizing our body on our right leg a lot more than our left, we're gonna start to see that our right foot becomes more supinated, and it's not really real supination, it's more fake supination, which is a concept for another video because it's kind of confusing to explain. But for now, just know that it's more like it's not actually supinated, but just simply seems supinated based on the way that our center mass is shifting. And that's for that right foot. So supinated, that arch is higher on that right foot. And for the left foot, we have the opposite. Our left foot is pronated and the left arch shrinks significantly. It flattens. And generally what you're going to find is that when you're walking, especially with feet that are constantly stuck in this position, is that you're going to feel the left arch of your foot when you walk a lot and the right heel of your foot when you walk a lot. And in postural restoration, the solution to that, ironically, is eventually getting our left heel to activate ground strike, for lack of a better term, and that right arch. Kind of want the opposite of what we're dealing with right now. We want to get that left heel back and that right arch back. So in terms of the feet, that is a very good indicator of what might happen there. And in terms of right BC pattern, I would say rib cage positioning. So if your rib cage looks like this, I'd say lying down, especially with your knees bent, lying flat in your back, your butt is flat on the ground. I will put a picture of that at the end of me talking about the right BC indicator as well, just so you have a good idea of how to perform this and kind of feel it out, for lack of a better term, because that's the easiest way to find it. So if your rib cage feels more inflated on the left side, so you lie down in the position that I'll show you right here on the screen, and you put your hands kind of at the bottom of your rib cage, and you find that your left hemi rib cage is more prominent, for lack of a better term, than your right hemi rib cage, so it feels like this side sticks out more than this side, that is a very good indicator that you are in a right BC pattern. And again, that's because it is rib cage positioning, right? This is more, for lack of a better term, the direct problem rather than the feet, which are more of a symptom of pelvic dysfunctions. So those are kind of the two big things I'd look for outside of what I'm about to talk about next, which is postural analysis and the effects it has on your whole body. So I'm going to show an unedited picture of an anterior view and a posterior view of me a couple of years ago when I was dealing with more chronic pain issues. So I was dealing with some slight knee pain, some slight shoulder pain, some more lower back pain. Nothing too dramatic, just stuff that's more like a mild nuisance, but it still was debilitating to some extent. It's not fun to deal with pain, regardless of how strenuous or how much it affects your life. Okay, so unedited picture from a front view. This is what I look like. Leave it on the screen for a couple more seconds. Unedited picture from the back view. This is what I look like. Again, leave it on the screen for a couple seconds. So if you tried to pause it and look for things, it might be hard to see things, which is why I'm going to show you edited pictures where I draw lines and overlay so that you can see some common findings in these patterns. So starting with a front perspective, we're going to talk about left AIC more and general orientation of right BC as well. So in this picture, which I'm going to leave on the screen as I discuss this, here's what's happening. That arrow above my head is showing the direction that my torso is moving in. It's showing that my torso is orienting itself counterclockwise. That is what my torso is doing. And when my torso is doing that, or I should say while my torso is doing that, my pelvis is orienting itself clockwise. So the torso is going left, pelvis is going right. And if you look at the picture edited beside me, you should be able to see a lot of arrows kind of by my knees, and that's indicated by the feet as well that I kind of discussed earlier in this video, right? So having that center of mass shift to the right is going to make it so that your right hip comes up more and your left hip sinks down more. And this is just, again, because you're on that right leg. Center of mass is shifted to the right, and now you have feet that are stuck in fake supination and fake pronation as an end result of pelvic dysfunction. So that's a very common thing with left AIC that you might want to look for, is look at the positioning of your hips. Try and draw a line, and if it's not straight, especially if it's a line that goes up more towards the right hip over the left, then that is a pretty good indicator that, hey, we might be having some issues with this. Okay, so that's from a front view, kind of the basics of what I think you should look for. And again, you can look at the picture, see how I'm trying to indicate that right leg is coming up, that left leg is sinking, and that pelvis position is a big reason why. Now, if we look from the back view in this picture, and I'll leave that up for as long as I'm talking about it, you can see some stuff a little bit differently. So at the bottom now, where my feet are, I'm trying to indicate that my pelvis is moving in a clockwise or rightward oriented motion, in contrast to what I previously described with the front picture where my torso is moving in that counterclockwise and or leftward orientation. So that's what's happening at the feet. We kind of already discussed the feet and the hips. What's happening at the shoulders? So what's happening at the shoulders is this. First thing that's important to know, and this was also in the front picture as well for those that didn't look, just like the hips are in the back picture as well that's being shown right now, is that the left shoulder is sitting higher than the right shoulder. And again, this is a good indicator of right BC because it's showing us that the rib cage is moving to the right, or I should say it's moving to the left, not the right, but I'm saying that because the right side of your rib cage is coming forward and the left side of your rib cage is coming backward, for lack of a better term. It's orienting like counterclockwise. So you have to think that right shoulder is coming forward, that left shoulder is coming back, and you can see how the scapulae, especially in that back picture, are affected by this positioning, right? So the scapulae, the left scapulae is elevated, and I believe it is internally rotated, I'm pretty sure. Well, the right scapulae is externally rotated and depressed, and they're moving this way because of the rib cage positioning, because that rib cage is orienting itself in a counterclockwise motion. So that's important to understand because this is, again, a very common finding in postural restoration, or in people that are dealing with chronic pain, I should say, that don't necessarily understand why. So hopefully some key takeaways from this video. Again, as I mentioned at the beginning of the video, you want to pay attention to your feet, you want to pay attention to your rib cage positioning, and you want to, if possible, take pictures similar to the ones that I've shown here and try and examine them as best you can. Obviously, if you're not trained to see this stuff, it is very difficult to see it, but If you want to, you can try to contact me. I'll get back to you and I can try and take a look at pictures if this is something you want from me and tell you whether or not, hey, I see these common findings or I don't see these common findings. But hopefully this video gives you some idea of how you would know you are a pattern individual, and especially if you're someone dealing with chronic pain, how these patterns can be the root cause of your chronic pain. I think that's about all I have to say on the subject. Thank you for watching. I appreciate you taking the time for this, and I hope it was informative and helpful. Please consider liking, sharing, and subscribing to the channel if you like this content, and I will see you guys in the next video.